accomplishments, and with that I have the pleasure of inviting Oleksandr Haluzynskyi to present on the subject for Osseointegrative limb prosthetics, who's managing the Center for Complicated Endoprosthetics, Osteointegrations and Bionics. Being an orthopedic traumatologist in his background, be kindly reminded that you will have 15 minutes for your presentation, and also we are reserving some time for questions immediately after the presentation. In any case, if any question comes to the top of your mind for additional discussions, we will have a networking event at the end of the business day in our summit. With that, dear sir, happy to welcome you to our summit. The warmest welcomes, my dear colleagues. And today I have the pleasure of raising the item of also integrative limb prosthetics in general, particularly in Ukraine as well. Speaking of our Center for Osseointegration and Bionics has been established this year in the month of July. At this moment, we have 3 clinical sites included into this project, where we are performing surgeries, starting with the private clinic Mirum, Kyiv Regional Rehabilitation Center, and Center for Prosthetic Support Give Hands Back to the Heroes. So, speaking with some basics and definitions, osseointegration, here you can see it obviously in the X-ray. So, one question with a regular sleeve-type prosthetic device, and an alternative picture with osseointegration, where part of such prosthetic device is implanted into the bone. Trying to describe the history behind it, this idea was first generated back in 1940, when it was observed rather than invented by both Beaton and Davenport. While performing different experiments with animals, they discovered the growth of bone tissue cells on titanium implants. Later, in 1951, Leventhal and co-authors first described the process of such integration using titanium screws which were inserted into femurs of the rats. Later on, Brainmark in 1952 has implanted titanium rods into rabbit femoral bones to study the blood flow at the implantation site. By the way, Brainmark, he was a dentist, and thanks to his invention and research experiments, we also have the tooth implants, which are commonly used today. But coming back to Brainmark, he decided to develop one's idea, and later on, in 1990, Sweden has established a special center for implantation of the limbs. And with that in mind, let us consider some of the advantages of osseointegrative prosthesis. First of all, such prosthesis does not damage the soft tissues and does not compress the stump itself, which is particularly important in case of short stumps. In this slide, you can see the results of such prosthetic application in the shoulder bone, as well as the first number in the wrist and some of the limbs examples as well. Further looking at the advantages, first of all, we have to consider that in comparison with the prosthesis equipped with a socket. And here we observe better functionality, both objectively and subjectively, based on the patient's self-reported information. And through the studies using SF-36 scale, we can see quite substantial quantitative improvement reflected in the number of score points when providing for comparison analysis. At the same time, we have to consider some complications. And first and foremost, which comes to the top of your mind, would be different infections, because any surgeon, any orthopedic traumatologist considers such osteointegrative device as an open gate for infections. And looking into different publications, they're quoting different prevalence rates, but in the range from 28 to 36 would be the reported number of infection cases, most of them being superficial and conditional to appropriate superficial wound management and some medication. This can be managed quite successfully. Also, deep tissue infection could be observed in 3 to 8% of cases over the follow-up period of 2 years and more. Also, periprosthetic fractures observed in 3 to 6% of cases over the follow-up period of 3 years. As you can see in the publications mentioned here in the reference. And depending on the additional safety features embedded into the structure of such prosthesis, the prevalence of such cases could be definitely going lower. Remembering some of the counterindications that also has to be taken into consideration, first of all, involving patients with incomplete osteogenesis, congenital and acquired bone deformities, osteomyelitis of the bones in the stump, osteoporosis, or age older than 65 or younger than 22, excessive body weight over 100 kilograms, occlusive diseases of the vessels, diabetes, neuropathy, pregnancy, mental conditions. With above facts taken into considerations, let us also consider the advantages which will be outweighing those counterindications to see what the direct indications will be. First of all, we have to understand this is not a magic rod. This is not a panacea. And I do remember taking part in the Bologna event recently, where we discussed the advantages of osteointegrative prostheses, namely because they are not fit for regular prosthetic devices and solutions. And that is where and why we are offering every patient to try the conventional prosthesis, and only if that does not suit their particular case specificity, or if they have any inconveniences or dysfunctionality resulting from the sleeve prosthesis, then we continue discussing the osseointegrative solutions, considering all pros and cons with them to make a well-balanced decision. So remembering this situation, and particularly looking at the high prevalence of amputations, and also seeking to resolve the issue of osteointegrative prosthetics, we created the Ukrainian Association, bringing together orthopedicians, traumatologists, occupational specialists, rehabilitation professionals, trying to boost its development in Ukraine. As part of that initiative, we arranged for internship at the center's doctor of the environment clinic and the professor's Horst Eschhoff's clinic in Germany. Also, we had different meetings and symposia, as well as webinars with Oskar Asman discussing bionic solutions. Later on, I will cover that in greater detail. And of course, when it comes to surgical interventions as part of the comprehensive measures associated with osseointegrative solutions, that would be the visit by the Professor Brainmark. This year he arrived to Ukraine in May, and we had 3 demonstrations in surgical theater. His next visit was in September this year. We had 5 more demonstrative surgeries, particularly with the patients with a short stump of the shoulder bone, considered for osseointegrative solutions. And the surgical technique involves two stages. First one to install the implant, and the second stage 3 months later to install the so-called abutment, which is the connection device between the bone implant with the external prosthetic device. And further speaking of osseointegrative devices for different extremities, then of course the bone structure has to be assessed along with the soft tissue status, and sometimes we might consider having both stages performed at the same time. And here you can see the x-rays of one and the same patient who had such dual stage surgery performed at one operation. Also, international conference and workshop on osseointegration and bionic limb reconstruction, which was discussing the current stage of developing this technique. And also taking that into the future. So now you can see the flowchart of the Opera implant, which is developed by the Swiss company in Devon. It has been used in a number of patients across the globe prior to its certification by the FDA. The idea is that intraosseous implant, which will have the bionic prosthesis attached to it, will have the electrodes connected to the muscles and nerves, and thus providing for conscious management of the bionic prosthesis operations. And today, this is the future which is coming basically today. And in that conference, we had multiple presentations dedicated to bionic prosthetic solutions. And I hope and believe that we will be advancing in that same direction. Here you can see another scheme describing how osseointegration of the shoulder bone might be taking place. The so-called TMR plus RPNI integration, when the residual nerve is connected with the respective electrodes within the stump, and thus the patient has an additional opportunity and a capacity to build on for the benefit of using a bionic prosthesis. So just like we can provide for our muscle operations in the chest and the shoulder, equally to that, we can be operating different muscle groups, and this could be used either for contraction or of other functions of our upper extremity. Similar solutions and visualization in the patient who had his upper shoulder operated, and this was performed in a clinic in Austria by Professor Dr. Azar.
Way he addresses that arm. Now, obviously, we want to get away with the cables, and I think anybody who's active in the field is trying to get that done, but it's not so easy.
Ну, якщо ви знаєте, як виглядає протез верхньої кінцівки, тобто це цілий такий пан.
And again, if you remember the conventional prosthesis design, this will be a very massive sleeve which covers not only a shoulder but also part of the breast and supraclavicle area, which is very complicated, highly expensive, and definitely its replacement with such user-friendly and highly effective bionic prosthetics is highly effective, and it does look clumsy and difficult to use, but it seems to be fully functional. And pay attention to the length of the stump, because he can fully provide for the function of both the brachial part as well as the shoulder joint, and even operate the palm and fingers. So definitely these are highly promising results of the first experiments, and I hope that soon enough we'll be discussing great applicability of osteointegrative solutions and bionic reconstruction. Excellent presentation. Are there any questions about that? If not at the moment, maybe there will be some inquiries during our networking events. So thank you for your experience. Thank you for your passion. Let us all pray that we have the smallest possible number of patients requiring such assistance, but all of those who need it will definitely be provided.